हमारे जो मीडिया के फ्रेंड्स हमारे साथ हैं उनसे विशेष अनुरोध है कि आप बैठ जाएं, जो आपके इनक्लोजर है वहाँ पर आप अपना स्थान लें। Ladies and gentlemen, please join us now in extending a very hearty welcome to the Honorable Minister for Health and Family Welfare, Shri J.P. Nadda ji. And also joining us are the Honorable Ministers of State for Health and Family Welfare, Shri Fagan Singh Kulaste. Also welcome to Shrimati Anupriya Patel, the Honorable Minister of State for Health and Family Welfare, our UNICEF celebrity advocate, Mrs. Madhuri Dikshit, respected Secretary, Ministry of Health and Family Welfare, Shri C.K. Mishra ji, Secretary, Ministry of Women and Child Development, Ms. Leena Nair. May I request all our distinguished dignitaries to please grace the dais. Also joining us is Director General Health Services, Dr. Jagdish Prasad, the UNICEF representative to India, Mr. Louis Georges Arsenault, and the Additional Secretary and Mission Director, National Health Mission, Dr. Arun Kumar Panda, along with Joint Secretary, Ministry of Health and Family Welfare, Ms. Vandana Gurnani. Ladies and gentlemen, please be seated. Honorable ministers and other distinguished dignitaries on the dais and off the dais, our esteemed guests, special invitees, the senior officials present with us from the Ministry of Health and Family Welfare and from various ministries, the heads and representatives from our development partners, academicians, researchers, and most importantly, a very special welcome to our healthcare workers, the community workers, the Anganwadi workers, ASHA workers who are specially present with us to share with us their stories of change and impact which they have been able to make, and then our friends from the media, all the participants, ladies and gentlemen. It's a pleasure to welcome you all on behalf of Ministry of Health and Family Welfare to this very special program wherein we are going to be witnessing the launch of the nationwide program for promotion of breastfeeding. The launch of the program MAA, Mother's Absolute Affection. And this launch, ladies and gentlemen, comes at a very opportune time where world over the first week of August is being celebrated as the International Week towards promotion of breastfeeding. And this is once again a very decisive initiative and a breakthrough initiative which has been taken by the Ministry of Health and Family Welfare under the dynamic leadership of our Honorable Minister, Shri J.P. Nadda ji. So at the very outset, we would like to express our greetings and thank him for extending his dynamic leadership to this entire initiative and further accord him a green welcome. May I request the Honorable Minister, Sir, Shri J.P. Nadda ji, to please accept this plant as a token of our good green welcome and greetings to him. Please join us, ladies and gentlemen, as we welcome him. Would also like to welcome the Honorable Minister of State for Health and Family Welfare, Shri Fagan Singh Kulaste. माननीय मंत्री जी का बहुत बहुत स्वागत और साथ साथ बहुत शुभकामनाएं उन्हें. Also, our green welcome to the Honorable Minister of State for Health and Family Welfare, Shrimati Anupriya Patel. She's going to be joining us shortly. We welcome the UNICEF celebrity advocate, Ms. Madhuri Dikshit. Thank you so very much, ma'am, for being with us here. You're actually the voice of this entire program. Thank you so very much. Our greetings to respected Secretary, Ministry of Health and Family Welfare, Shri C.K. Mishra ji. And also our good greetings to respected Secretary, Ministry of Women and Child Development, Ms. Leena Nair. Our greetings to Director General Health Services, Dr. Jagdish Prasad. A very humble request to our friends from the media, if you can kindly settle down, if you can please be seated. Thank you. UNICEF representative to India, Mr. Louis Georges Arsenal. Thank you so very much, sir, for gracing the occasion. Welcoming now Additional Secretary and Mission Director of the National Health Mission of the Government of India, Dr. Arun Kumar Panda. And good greetings to Joint Secretary, Ministry of Health and Family Welfare, Ms. Vandana Gurnani. And now, ladies and gentlemen, we mark the auspicious inauguration of this initiative of social and national importance in our true Indian traditions and customs by lighting the ceremonial lamp. I would like to request the Honorable Minister, Shri J.P. Nadda ji, to please light the ceremonial lamp, a symbol of hope, and also requesting all the distinguished dignitaries on the dais to please join in the auspicious act. Once again, a very humble request to our friends from the media. You will be able to take pictures, but just a request to kindly remain in the enclosure, please. हमारे मीडिया के फ्रेंड से विशेषकर निवेदन है इस ऑस्पिशियस सेरेमनी दीप प्रज्वलित कर हम इस आज के इस कार्यक्रम का विधिवत और ईश्वर की असीम कृपा के साथ, ईश्वर की प्रार्थना के साथ इस कार्यक्रम का उद्घाटन करें। तो ईश्वर की आराधना के साथ और आप सभी की शुभकामनाओं के साथ आज के इस कार्यक्रम का विधिवत और मंगलमय शुभारंभ। Thanking once again the Honorable Minister. A request to the friends from the media to kindly remain in your enclosure so that we can continue with the rest of the program, please. Now, ladies and gentlemen, we're all gathered here to lend our support and to reaffirm our commitment that every child in this country gets a sound foundation through breastfeeding. And as all of us are pretty much aware that breastfeeding can significantly improve child survival. So in this week of international promotion of breastfeeding, the Ministry of Health and Family Welfare, along with its various development partners, is intensifying efforts to improve nutrition of infant and young children with a focus on breastfeeding. And the Mother's Absolute Affection Program further conveys the message that स्तनपान विकल्प नहीं संकल्प है. And bringing this message, driving this message, we bring you now a short film, Breastfeeding Matters. So this incredible, vibrant India can be a real healthy India if you're able to ensure good nutrition to every child, every infant through breastfeeding. And now may I request Dr. Arun Kumar Panda, Additional Secretary and Mission Director of the National Health Mission, for his welcome remarks.
Honorable Union Minister of Health and Family Welfare, Sri J.P. Nadda ji. Honorable Minister of State, Health and Family Welfare, Sri Fagan Singh Kulaste ji. The icon and UNICEF celebrity advocate, Ms. Madhuri Dixit ji. Sri C.K. Mishra ji, Union Secretary, Ministry of Health and Family Welfare. Srimati Leena Nair ji, Secretary, Ministry of Women and Child Development. Dr. Jagdish Prasad, Director General Health Service. Ms. Vandana Gurnani, my colleague and Joint Secretary in the Ministry. Louis George Arsenault, UNICEF representative to India. Senior officials, friends from the media, ladies and gentlemen. A very good evening to all of you and a very hearty welcome to all of you. Under the National Health Mission, a life cycle approach has been adopted for breaking the intergenerational cycle of undernutrition. As the events leading to undernutrition often predate the birth of the child, such as maternal undernutrition, adolescent pregnancy, less spacing between births, and high birth order, resulting in birth of low birth weight babies. Now, when we are launching this particular program, MAA, Mother's Absolute Affection, which will be implemented across all states, pan-India, starting from this month, this provides an opportunity to improve rates of breastfeeding and appropriate child feeding practices in the country. I mean, as was just mentioned in this last brief film, short film which was shown to you, there is no vikalp, there is no option. I mean, I was just thinking about, like for example, our old practice of yoga, which doesn't cost us anything. The breastfeeding is just like a vaccine for the newborn and also for the mother. There are many misconceptions which perhaps show us, because when we find the rate of breastfeeding, it's really not 80% or 90%, much less than that. So what we need to do, we need to have a real program, a real brand ambassador who can connect with the people, a real vision, leadership, drive, and a commitment to this program. We also need a strategy for the IEC, for making people aware of this particular program. And also we need training of the ground workers, the field workers like ASHAs and ANMs, which this program is going to have. I welcome you all again to this program, and I'm absolutely certain with the vision of our Honorable Minister and with the brand ambassador that we have with us and with the leadership of our Secretary and the help of UNICEF and all other stakeholders, we are definitely going to make it a big success, and a lot of people are going to benefit from this, both the newborns and the mothers are going to benefit from this. I again thank you all for coming over and making this program a grand success. Thank you.
Thank you, sir, for bringing in your views and the approach which you feel is required for the success of this program. And we now seek the technical advice and the insights of Director General Health Services. I would like to request and invite Dr. Jagdish Prasad for his address.
Good evening to all. Honorable Minister of Health and Family Welfare, Sri J.P. Nadda Sahab, Minister of State, Sri Fagan Singh Kulasti Sahab, our Secretary Health, Sri C.K. Misra ji, icon UNICEF celebrity, Srimati Madhuri Dixit ji, Secretary Women and Child, Srimati Leena Nair ji, our Additional Secretary Arun Panda ji, Louis George, UNICEF representative of India, the program's Joint Secretary Vandana Gurnani ji, all the senior officers, Madam Nada, and friends, ladies and gentlemen. This is a great occasion which today our minister is going to launch. Mother absolute affection. All people knows mother's affections. Absolute affections, we are just giving it. They have absolute affection, there is no doubt about that. But why we have put this name absolute affection? Because mother's affection to child is not up to the till she is pregnant, but lifelong. And that starts as soon as the child born. We don't realize that child, when is the mother womb, there is a different environment. And the moment he comes out of that environment, he born, he is exposed to like a man landing on the moon, such type of environment. And where the child requires a strong immunity in the body. And that a strong immunity, if you don't feed within 1 hour of the delivery, it causes lots of problems. Because it is not the question that how much time you take, but it is very important that you must give your breastfeeding within an hour of child born, because immediately the child requires a immunity from the mothers. The breastfeed, which once upon is thought to be not very nutritious, as after the long of research, no milk can compare the breast milk, mother milk. It not only provides the immunity to the child, it provides to fight with many immune system of the body. As just now Mr. Panda has pointed out, it gives double immunity, not only to the child, against all the disease which is going to occur in the lifetime. It gives the immunity to mother. It prevents the mother about, if you say that for cervical cancer we have to use the vaccine, I think mother who give the breastfeed to the child, about 1/3 of the breast cancer can be prevented to the mother by long breastfeeding of the child. So it itself is a vaccine to the mother for the breast cancers. The immunity which they get the child is preventing from the diarrhea, pneumonia, and many non-communicable diseases. It has been observed that wherever the breastfeeding practice is not done, the incidence of pneumonia increases 15 times, the incidence of diarrhea increases 11 times, and there is a high mortality rate which can be prevented. In the newborn, about 20% mortality, and in the below 5 years, 13% mortality occurs because of not early breastfeeding. So the breastfeeding, early breastfeeding is such an important task which people are not aware. And even we have come up with the 70 to 80% of institutional delivery to the baby. But still, as far as the breastfeeding is concerned, it is quite low. And especially the first few days, the colostrum, which comes for 1 or 2 days to the mother milk, is a very important component. It not only contains all the immunoglobulin, IgA, which is more important, but it also contains such a nuclear factor that you can prevent the premature retinopathy, you can prevent the non-communicable disease, you can prevent the obesity. And it not only that, many diseases which can occur in the life is related to the breast milk. So it is how important this has to emphasize during the antenatal care. I think the gynecologist has a very important role to play when the mother is coming for the antenatal checkup. They must teach that how important your breastfeeding is going to happen. And with this concept, I think we will able to decrease the mortality which is occurring by the pneumonia, by the diarrhea, and even many non-communicable disease which occurs. Even it has been seen that leukemia, the prevalence of leukemia also decreases when you do the breastfeeding. And if you do the breastfeeding for the 6 months, the child doesn't require even the water, because water is also sufficient amount. They don't require any amount. The only things when the mother starts breastfeeding, they have to give most important is multivitamins, because the amount of the vitamins decreases in the body, so the vitamin supplements requires, and especially the vitamin D has to be supplemented to the mothers. So with this concept, the Ministry of Health and Family Welfare is launching the mother's MAA, absolute affections. It is not a new word to all the people. We all know that how much mother is important in the life, whole life, whether you suffer from any disease, whether you suffer from any problems. And that is why the importance comes of this milk. And this has been replaced in even the Western country also. People are encouraging more and more breast milk. Even breast milk is a storage kept and can be used for later on. And it has been said that if you can use more times, it gives the immunity much more than that. As you have just now seen, the brain development also takes the first year of the life. And 90 days of the breast milk is one of the most important things which happens. And this 90 days, you must feed with the breast milk. Don't give any supplement they don't require. Only thing the mother requires nutrition. With these few words, I think all the delegates who are sitting here will propagate, and with launching this program in the whole country, the Government of India has sanctioned about 30 crore rupees, giving to 4.5 lakh rupees to every district, and they are so that the IC activity, the ANM, the nurses can propagate and can teach the mothers that how important the breastfeeding. It is not only that, even the first breastfeeding can stop the postpartum bleeding. It causes the shrinkage of the uterus. So, and evolution of the uterus occurs very fast. It gives some sort of amenorrhea. So you can think of that it gives the contraceptive types of developments. So this is important, not from point of view of mother and baby, but also important from the whole country as a control of the population. So this is a very, very important thing, and I think launching this will definitely decrease the baby mortality which occurs in the country. With these words, I thank all of you for hearing here, and I think all of you will participate in propagating this, that how important the breast milk is. Thank you.
Thank you, sir, for highlighting the very thought and mind which is behind designing this program, MAA, Mother's Absolute Affection, which drives in the message which it is bringing in, the benefit of the mother's milk. And may I now request the UNICEF representative to India, Mr. Luis Georges Arsenault, for his views and reflections on UNICEF's support and further contribution on the breastfeeding promotion program.
Mr. J.P. Nadar, Honorable Union Minister of Health and Social Welfare, Fagan Singh Kulashti, Honorable Minister of State, and also Ms. Anupriya Patel, Honorable Minister of State, Ms. Madhuri Dixit Nini, I said well, or no, UNICEF Celebrity Advocate, and also Mr. Shiki Mishra, Secretary, Ministry of Health and Family Welfare, Ms. Leela Nair, Secretary Women and Child Development, Dr. Jagdish Prasad, Director General Health Services, Dr. Arun Panda, Additional Secretary, Minister of Health and Family Welfare, and Ms. Vandana Gordani, Joint Secretary, Reproductive and Child Health. And also, I want to mention Anjana Chodi, which Ashas, and also Vilma Diva Angari workers from Lalitpur districts, which is with us tonight. So friends also from the media and friends of the media and ladies and gentlemen. I'm very happy to be here tonight because this is a very important event. This is a very special event also. We are here together the week of the breastfeeding. And this is a very important issue because for years, many of us have been advocating and addressed for this issue very wholeheartedly. And what it is the most natural phenomena of optimal breastfeeding. I think we have heard and we will continue to be hearing that breastfeeding has been highlighted by all of us. This simple but high impact nutrition intervention of breastfeeding is critical for saving life of children. And as we know, early initiation of breastfeeding can avert up to 20% of neonatal death, plus it enhances child cognitive and physical development, as well as protecting, by the way, mother's health. When we look at a larger commitment made to the SDGs, breastfeeding is a cornerstone for child survival, growth, and development. As a central part of this agenda, which we call the Global 2030 Agenda for Sustainable Development, this high-impact nutrition intervention helps to reduce inequities, saving children's lives, and contribute to improve health income for women and children. It is estimated that by addressing fully breastfeeding, it will add $300 billion to the world economy on a yearly basis. Exclusive breastfeeding for the first 6 months is one of the top nutrition interventions for reducing under-5 mortality. It also, and is very important, linked to gender inequality issues, including workplace rights, and it leaves minimal economical footprint, as we saw in the video. Also, it's important to mention that complementary feeding from 6 to 24 months with continued breastfeeding in particular is crucial for preventing stunting, which, as we know, is a form of chronic undernutrition. So there are challenges, and I just want to mention a few, because despite the compelling evidence, many children in the world are not optimally breastfed. In India, I think the numbers were also in the video, less than half, 44.6% do not start breastfeeding within the first hour of birth, leaving many infants vulnerable, missing out of the simplest protection from dying on the most vulnerable time of their life. In India also, this is an opportunity because, as we know, 80% of births are now taking place in health facilities, which provide us with a unique opportunity to improve early initiation of breastfeeding. The opportunity is there, it's up to seize it, up to us to seize it. Similarly, over 1/3 of children in India are not receiving the protective benefit of exclusive breastfeeding up to 6 months of their life, and only half of our children are given complementary food in appropriate time. So what can be done? And we know what can be done, but I think it's important to emphasize that for all mothers to be breastfed successfully, they need breastfeeding-friendly policies, health systems which are friendly, workplaces which are friendly, and communities also which integrate breastfeeding. So this is also about a mindset of the place of the woman plays in society. Also, skills, support, and guidance during breastfeeding empower women and does build their confidence that translate into better breastfeeding rates. Therefore, a renewed trust needs to be given to promote breastfeeding. I think this is why we are here tonight. This can be done by informing mothers, families, and employers about the benefit of breastfeeding, and by ensuring that the mothers receive counseling and required support from skilled healthcare providers to successfully breastfeed, so that their children can actually grow and to their optimal development potential. So, for us, promoting optimal infant and young child feeding and care is central to UNICEF work. In collaboration with state governments, and we have been supporting building the capacity of facilities and community-based workers such as ASHAs, as I mentioned, and Anganwadi workers to provide information and counseling to mothers, their families, and feeding on children. These efforts complemented with our engagement with civil society, which is critical, professional bodies, and also the telecom partners to extend the reach to communities and family, including very much, and I think it's important to mention that, the hard-to-reach communities and population. that should not be left out in this conversation. So the launch tonight of the Mother Absolute Affected is something that for us, it really demonstrates the willingness and leadership of government, which is committed to accelerate improving of breastfeeding rate in India. So MAA, or MAA, is a nationwide intensified initiative of the Ministry of Health and Family Welfare to promote optimal breastfeeding. It aims to provide skill support to the mothers through the health system, which is very important, at a critical point of time during pregnancy, at the time of delivery, and also the first few months of life. This is quite a commendable effort, but it will also need to be backed up by making more efficient the system and investing more available resources so the healthcare system are genuinely breastfeeding friendly. Finally, promoting optimal breastfeeding is not the sole responsibility of the government. Government cannot do it alone. Rather, it is a collective social responsibility. Ms. Madhuri Dixit Nini is really setting the tone by lending her full support to promoting the case of optimal breastfeeding. So I thank you for this. I recognize, also I want to recognize the efforts of other actors such as Bill and Melinda Gates Foundation, BBC Media Action, Breastfeeding Promotion Network in India, and many other partners and technical agencies that have supported the government of India to the launch of MAA program tonight. So UNICEF stands ready and committed to continue to support, and I can assure you that we are going to continue and meaningful support to MAA program. Thank you very much for your attention. Merci beaucoup.
Thank you very much, sir, for highlighting the socio-economic and the health benefits of mother's milk. And if this message is impressed upon every mother and the family, it can make a significant difference in creating a healthy society. Thank you so very much, sir, for your views. Ladies and gentlemen, we have just been joined by the Honorable Minister of State for Health and Family Welfare, Srimati Anupriya Patel. We would also like to extend greetings to her by presenting her the plant. May I request you, ma'am, to please accept this green welcome on behalf of everyone present here. Thank you so very much for gracing the occasion. Okay, thank you so very much to our friends from the media. Please take your seats. Thank you. And now I would like to request Ms. Leena Nair, respected Secretary, Ministry of Women and Child Development, to kindly address us on this occasion.
Shri J.P. Nadda, Honorable Minister for Health and Family Welfare, Srimati Patel, Honorable MOS, Health and Family Welfare, Shri Khulaste, Honorable MOS for Health and Family Welfare, Mrs. Madhuri Dixit, UNICEF Celebrity Advocate, Shri C.K. Mishra, Secretary, Ministry of Health and Family Welfare, other dignitaries on the dais, dignitaries in the audience, senior officials, friends from the media, ladies and gentlemen. The month of August always begins with the National Breastfeeding Awareness Week. This year, we have kicked off on a high and on a totally different kind of note with the launching of the program MAA. I must congratulate the Ministry of Health and Family Welfare for launching this program on breastfeeding promotion. I must appreciate and congratulate them once again for the choice of the very appropriate name for the program, MAA, Mother's Absolute Affection. It has a really emotional appeal. As has been said by a number of people and also by the movie which we have just seen, while not all of the breast milk's properties are understood, we all know its nutrient content is relatively consistent and contains everything which the newborn requires to grow. Also, the immunological substances effectively defend against infectious disease and protects the infant. It's said that the death of an estimated 820,000 children under the age of 5 world over could be prevented every year with increased breastfeeding. It protects and prevents death for children. Further, it has also been said earlier that breastfeeding is an important preventive health measure for the lactating mother, as it is associated with a decrease in the number of incidents of breast and ovarian cancers, and a delay in the return of ovulation and a greater postpartum weight loss, and is economical for families with no need to purchase bottles, formula, or milk. Cost analysis indicate further savings to the society in general by improving the health of both mothers and infants. My ministry, that is the Ministry of Women and Child Development, has developed various IEC materials like booklets on national guidelines on infant and young feeding and nutritious recipes for complementary feeding. We have got audiovisuals, films, jingles, and short films which are screened exclusively in all hospitals on Navjat Ki Suraksha. These have been translated into various languages and have been shared with state governments for wider screening. I would like to assure the Ministry of Health and Family Welfare that the full cooperation from our ministry for coordinating this program and taking it forward will be there. While once again congratulating the ministry on the name of the program MAA, just as you never question the mother's love, similarly, you do not question breastfeeding. It's wholesome, it's good, and it has never been recalled like some of the milk formulas. So I would once again thank them, assure them, and also say that MAA is better than MOO. And I would like to wonder whether the next time Mrs. Dixit, Madhuri Dixit ji goes on stage, she might change the dialogue. Mere paas MAA hai, aapke paas hai kya? Thank you.
Thank you so very much, ma'am, for so beautifully highlighting the very importance of the word MAA. And then, as you mentioned, there has to be more of an emotional appeal. After all, we are talking about the new generation coming in, also highlighting the various initiatives which are being taken by your ministry. I would now like to request Shri C.K. Mishra, respected Secretary, Health and Family Welfare, for his address.
Honorable Union Minister for Health, Shri J.P. Nadda ji, Honorable Union Minister of State for Health, Shri Fagan Singh Kulaste ji, Honorable MOS, Ms. Anupriya Patel ji, Secretary, Women and Child Development Department, Ms. Leena Nair ji, Ms. Madhuri Dixit ji, who's are leading this campaign of breastfeeding, particularly in the field of messaging to those who need it most. Mr. Louis George Arsenault from UNICEF, DGHS, Dr. Jagdish Prasad, Mr. Arun Panda, my colleague in the ministry, and Vandana Gurnani, several senior officials from the ministry, development partners, representatives, friends from the media, and other dignitaries in this hall. For me personally, it's indeed a very happy occasion because we've been working on this for some time. And against many odds and cynics and skeptics who thought this was no program to launch, we decided to take it up. The Honorable Union Minister one day told me that if we can't do things which are as simple as that, how do we do big things? We took it up as a challenge, and in the last 3 months, we really worked hard on it to come up with a concept and a program that's not just enunciation of a desire, but a program rolled out in terms of concept and programmatic approach, so that we are actually able to reach it to every facility and every mother who we intend reaching it to. And I must thank my team for having put in long, long hours to actually do this. Many a times we feel that the simplest things are the most difficult to achieve. Many of us here and outside this hall always think that we know all about breastfeeding. The fact remains that most of us do not know the critical elements. That's because there is a lack of awareness, there is a lack of understanding, and even the professionals who are supposed to push this idea to the mothers and others do not find it at the centrality of their program and thinking. They are too often clinicians working medically, but these interventions they are not able to push, and that is why we want it in a program so that we are able to train every layer of our frontline workers to get into this. For example, everybody thinks that the breastfeeding rates in rural India is very high. There is absolutely no difference between the breastfeeding rate in the rural area and urban area. It's almost the same. So these are misconceptions and concepts which we carry, and the problem that we get into is that everybody thinks that it's just about awareness and the mothers should just be told. It's not just about awareness. It's actually about support to the mother who delivers. Support from the family, support from the medical practitioner, support from the caregiver, and support from everybody who's around that mother, so that she is able to do what is the right thing to do. In fact, a few months back when we were discussing this problem, we realized that the women who are coming to facilities for delivery are quite often alone while delivering. So we came up with a concept that will allow birth attendants. Somebody who is from the family provides that bit of comfort to the mother so that she recovers faster, delivers better, and is in a better frame of mind even to do initial early breastfeeding. So that was the concept in mind when we worked on it, and we gave it a programmatic approach on both counts: early initiation of breastfeeding and exclusive breastfeeding for 6 months. In fact, if we are able to do this, the value add to the entire maternal child health program that we run in this country is going to be tremendous. The fact that we were not able to do it is because we never put it as a part of an organized program to be pushed in the field. We wanted really to fully utilize this opportunity that we have. Today, close to 80% women are coming to our facilities or any organized facility to deliver babies. The breastfeeding rate remains at 44%. So this is an opportunity available to us because the mother is with us, and with an appropriate message and a program, we can actually help them do early initiation of breastfeeding. And we are all aware of the advantages. We know that 20% of newborn death and 13% of the under 5 mortality can actually be prevented if we are able to initiate early breastfeeding all across the country. And 80% is not a small amount. Therefore, we really, really need to work on that. And this whole program is going to give us a huge support in preventing infant death. I'm not going to go into statistics, that's all available, and much of it you saw in the small video clip that we showed you. The cornerstone of whatever we do is partnerships. it is not possible for the doctor alone or the ministry alone to administer this program unless we have a strong platform of partnerships. And I'm extremely happy today and privileged that we have amongst us Secretary WCD, who is such a strong partner in actually delivering this in the field. Together with this convergence and with the partnership of UNICEF and all other development partners, we are very, very confident that within a short period we will be able to really push this program to a level where we can say that we have most of the mothers doing an initial early breastfeeding. So one issue is partner. Whenever we talk about health sector, we think of big interventions. I always feel that if you want to get to big interventions, please get your basics right. And one of the strong basics is breastfeeding. If we can get that right, all other interventions will fall in place. Your under 5 mortality will come down. Your neonatal mortality will come down. Therefore, it is these small things that really, really matter. And once we have done the basics, we can always build a large canvas. And with the kind of support we have from all of you, I'm sure the ministry in days to come will come up with such many more such ideas which will be able to transform the whole scenario of child mortality in this country. We've done well in the past. We need to do much better. And that is the message that we must send across to all our frontline health workers who are toiling day and night to achieve precisely this. We need your support. We need all of you to stand up for us. We need Mrs. Dikshit as a strong voice to convince mothers that this is the right way. And I'm sure it's a good beginning today and we'll grow as we go along. Thank you very much for being with us. Thank you, ladies and gentlemen.
Very much, sir, for highlighting the very concept behind this program, and I think all mothers and women present here cannot agree much less about that this program is for the support and the comfort to mothers and to women, and it is as much a program for the mothers as it is for the child. Thank you so very much. As you spoke about that, it's the basics which we need to first clear. Thank you. देवी सज्जनों, मेरे हिसाब से हम सभी इस बात से सहमत हैं कि इस पूरे कार्यक्रम की जो सबसे महत्वपूर्ण कड़ी हैं वो है हमारे कम्युनिटी वर्कर्स, हमारे आशा वर्कर्स, आंगनवाड़ी वर्कर्स जो ग्राउंड लेवल पर काम करते हैं. तो उनके विचार जानना, उनके प्रस्ताव, उनके सुझावों को आमंत्रित करना बहुत ज़रूरी है इस कार्यक्रम की पूरी सफलता के लिए. हमारे साथ यहाँ पर कुछ आंगनवाड़ी वर्कर्स और आशा वर्कर्स जो ललितपुर डिस्ट्रिक्ट से हैं उपस्थित हैं, उन्हें मैं यहाँ पर मंच पर आमंत्रित करना चाहूँगी. तो सबसे पहले अंजना चौबे जो बहुत ही कर्मठ और एक बहुत हमारी डेडिकेटेड आशा वर्कर हैं हमारे साथ हैं. आइए तालियों के साथ उनका स्वागत करते हैं. यहाँ पर मंच पर एक बहुत ही अच्छा काम कर रही हैं, उनकी कहानी, उनकी जुबानी.
मेरा नाम अंजना चौबे है. आशा जनपद ललितपुर से आई हूँ. 2006 में आशा का काम कर रही थी. 2007 में जब 3 दिन का स्तनपान की ट्रेनिंग मिली तो उसमें बहुत सारी बातें बताई गई, जैसे 1 घंटे के अंदर स्तनपान कराएं, 6 माह तक सिर्फ स्तनपान कराएं, और जिस माँ को गांठें पड़ जाएं स्तन में तो उसको कैसे सॉल्व किया जाता, और जो अंदर धसे हों, और जिस माँ को दूध नहीं निकल रहा है, जिस माँ के परिवार में दूध नहीं पिलाया जाए, इन सब बातों को बताया गया है. और माता समूह भी बनाया गया. आशा आंगनबाड़ी एक अन्य महिला का समूह बनाया गया. और ट्रेनिंग देने के बाद हम गांव में भ्रमण करने गए तो एक महिला देखकर रोने लगी. हमने कहा क्यों रो रही हो, तो कहने लगी हमारी सास हमें दूध नहीं पिलाने दे रही. तो मैंने माँ को बुलाया कि क्यों नहीं अपनी बहू को दूध पिलाने दे रही हो. कहीं नहीं नहीं, 9 महीने का गंदा छका हुआ दूध अपने नाती को नहीं पिलाएंगे, हमारा नाती बीमार नहीं हो जाएगा. हमने कि नाती को दूध अगर माँ का नहीं पिलाओगी तो बीमार हो जाएगा, गाय का दूध पिलाओगी तो तुम्हारा नाती बीमार हो जाएगा. और अपने नाती को दूध पिलाइए, क्यों कि आप मोहल्ले में अपने नाती को सबसे ज्यादा होशियार नहीं बनाना चाहती हो. तो कहने लगी ऐसा होता है माँ के दूध से. हमने कि हाँ, और आपकी बहू भी तो बीमार है. तो वो कहने लगी तो आप बताओ क्या करें. हमने स्तनपान कराएं. हमने उनको स्तनपान के बारे में बताया और पिलाया सामने, और घर चले गए. दूसरे दिन सुबह उनकी सास आई, कहने लगी आशा दीदी हमारे घर चलिए. हम आए और बहू देखकर हंसने लगी, दीदी आ गई हैं, रात भर हमारा बेटा सोया है, तो हमने कहा कि सास कहे या परिवार वाले, आप सिर्फ स्तनपान 6 माह तक करवाएं, दिन में 10 से 12 बार और रात के 2 से 3 बार। रात में ज्यादा दूध पिलाने से ज्यादा दूध बनता है और तुम्हारा बेटा बहुत होशियार होगा और तुम्हें फायदे भी होंगे। तो वो कहने लगी क्या फायदे होंगे? हमने की फायदे, तुम्हारे बच्चे को दूध पिलाओगी तो तुम्हारा बच्चा सबसे ज्यादा होशियार होगा, गांव में किसी का बच्चा होशियार नहीं होगा। और दूसरा फायदा आपको है कि आपके स्तन में गांठें नहीं पड़ेंगी, आप स्वस्थ रहेंगी और सुंदर भी बनेंगी, और आपकी सास भी नहीं लड़ेगी कि दूध मूल में कहाँ से लाऊं। और तुम्हारे समाज को भी फायदा होगा कि अच्छा नागरिक बनेगा, कल देश का नाम रोशन करेगा। और हम घर चले गए तो घर जाकर देखा कि एक महिला बैठी थी, उसके स्तन कटे हुए थे। कहने लगी आशा दीदी आप तो अस्पताल जाती हो, हमें दवा और ट्यूब लेते आना। हमने की ट्यूब और दवा स्तन का बना ही नहीं है। जो आप अपने बच्चे को दूध पिला रही हैं वही पीछे का गाढ़ा दूध आप अपने स्तन में लगाइए, बार बार लगाइए, उसी से आपका स्तन ठीक हो जाएगा। और उसका स्तन ठीक हो गया। फिर हम अस्पताल में गए तो एक महिला फिर मिली, कहने लगी हमारे स्तन अंदर धस गए हैं और हमारा बच्चा दूध नहीं पी पा रहा है। तो हमें ट्रेनिंग में बताया गया था कि सिरिंज से निकालें, तो हमने सिरिंज से निकालना बताया और उसका वो ठीक हो गया। और हमारे MOIC को पता चला कि हमारी आशा दीदी स्तनपान में काम करने लगी, माँ बच्चे की जान बचाने लगी। तो उनने हमें अस्पताल में परामर्शदाता बना दिया। बुधवार शनिवार को टीकाकरण होता था तो हमें वहाँ रख दिया। हमने 2-3 साल उनके साथ काम किया। फिर अभी आशा संगिनी की जगह निकली, हमने फार्म डाल दिया, उसमें हमारे MOIC ने आशा संगिनी बना दिया। आज 20-25 आशाओं पर हम काम कर रहे हैं और अपनी आशाओं को ये जरूर बताते हैं कि प्रसव होने के बाद तुरंत अपने घर ना जाएं और अपनी महिला को 1 घंटे के अंदर स्तनपान कराएं और उन्हें समझाएं कि 6 माह तक 1 बूंद पानी ना पिलाएं, सिर्फ माँ का दूध ही पिलाएं, जिससे तुम्हारा बच्चा कल का अच्छा नागरिक बने और तुम्हारे देश की उन्नति करे। और इसके बाद हम अपनी आशा बहनों की जीवन की उज्जवल की कामना करते हैं। हम सभी देश विदेश सभी माता बहनों से हाथ जोड़कर विनती करते हैं कि 1 घंटे में अपने बच्चों को स्तनपान कराएं, जिससे हमारे देश की उन्नति और उनका भविष्य उज्जवल हो। अपने जीवन
बहुत बहुत धन्यवाद और बहुत अच्छा काम कर रही हैं। और अब मैं विमला देवी जो हमारी आंगनवाड़ी वर्कर हैं उन्हें आमंत्रित करना चाहूंगी।
सभी के लिए मेरा नमस्कार। मैं विमला देवी आंगनबाड़ी जिला ललितपुर से आई हुई हूँ। मैं आंगनबाड़ी में 2001 से काम कर रही हूँ। इसके बीच में मुझे 2007 में स्तनपान का प्रशिक्षण दिया गया। जब प्रशिक्षण दिया गया जाने के लिए मैं तैयार हो रही थी तो मेरे मन में ऐसे प्रश्न उठ रहे थे कि मेरे को समझ आ रहा था कि मैं तो बहुत सारी चीज़ें जानती हूँ, ऐसी कौन सी स्तनपान की चीज़ सिखाई जा रही है कि मैं नहीं जानती हूँ। जब मैं प्रशिक्षण में गई और मुझे इतनी सारी चीज़ें समझाई गई, बताई गई मुझे कि मेरे को समझ में नहीं आया, तो मैं सपने में नहीं सोच पा रही थी कि इतनी सारी चीज़ें स्तनपान से इतना लाभ होता है। जैसे कि 1 घंटे में बच्चे को माँ का तुरंत दूध पिलाना, और वो अमृत के समान होता है। वो कुदरती टीका भी होता है जो कई तरह की बीमारियों से बचाता है, जैसे कि डायरिया, निमोनिया, पीलिया, ये सारी बहुत सारी चीज़ों से माँ का दूध बचाता है। और 6 महीने तक सिर्फ स्तनपान, यानी कि पानी घुट्टी सहित कुछ भी नहीं देना है, मुझे प्रशिक्षण में बताया गया। और 6 महीने के बाद जैसे बच्चा 6 महीने का हो जाता है तो उसमें ऊपरी आहार जैसे घर का बना हुआ खाना उसको मसल कर बच्चों को खिलाना है, और साथ साथ में माँ का दूध भी देना है। कम से कम 2 साल तक बच्चे का माँ का दूध जारी रखना है बच्चे के लिए। और फिर इसके बाद में मेरे को टीकाकरण के बारे में भी बताया गया। और जैसे माँ को दूध नहीं उतरेगा तो माँ का पीठ पर मालिश करके उसके दूध के बारे में भी बताया गया। बच्चे माँ के स्तन में जैसे गांठ पड़ जाती है तो मतलब वो किस प्रकार से ठीक करेंगे, दूध कटोरी में निकाल के ठीक करेंगे। ये बहुत सारी चीज़ें मुझे दिखाई गई हैं, और जो बच्चे के लिए और माँ के लिए और समाज के लिए क्या फ़ायदा होगा इस दूध से, वो भी मुझे जानकारी दी गई है। जैसे बच्चे के लिए अपन माँ का दूध पिलाएंगे तो बच्चे का मानसिक विकास तेज होगा, और मतलब तेज होगा। और माँ के लिए फ़ायदे हैं, जैसे कि काम पे बाहर माँ जाती है बाहर तो दूध लेके नहीं जाना पड़ा, अपना दूध पिलाया, बच्चों को कटोरी में निकाल के रखा, और बताया गया कि 8 घंटे तक वो माँ का दूध खराब नहीं होता है। बढ़िया साफ स्वच्छ जगह पर रखें और बच्चे को बार बार पिलाएं। ये सारी चीज़ें हमको जानकारी दी गई हैं। और बताया गया कि समाज के लिए क्या फ़ायदा होगा। तो समाज के लिए बताया गया है कि जैसे अपन बाहर से दूध खरीद के लाएंगे, फिर उसको गर्म करेंगे और लकड़ी ईंधन का खर्चा भी होगा। खेत पे खलिहान पे जा रहे तो वहाँ कहाँ गर्म करेंगे, इसलिए सबसे सर्वोत्तम माँ का दूध है। इसको अमृत के समान बोला जाता है, एक उदरती पहला टीका भी है। ये सारी जानकारी हमको दी गई। फिर शिक्षण के बाद में जब मैं अपने घर पे गई, फिर उसके दूसरे दिन हमने 3 महिलाओं का गठन बनाया, जिसमें आशा वर्कर, आंगनवाड़ी वर्कर, एक गाँव की अन्य महिला ली। और हम एमपी के सटे भरे गांव में रहते हैं, जहां हमारे यहाँ पिछड़ा इलाका है, जो जनजाति समाज के हमारे यहाँ शहरिया जाति के ज़्यादा लोग रहते हैं। जो रूढ़ प्रथाएं हमारे यहाँ बहुत सारी चलती थी, जैसे कि बच्चे को दूध नहीं पिलाना और मतलब तुरंत पानी, घुट्टी, शहद, अन्य कई चीज़ें दे देना बच्चे के लिए। और मतलब ये सारी चीज़ें हमारे यहाँ रूढ़ प्रथाएं थी। जो 1 घंटे के अंदर जो दूध निकलता है वो 4 दिन तक हम लोगों के यहाँ दूध नहीं पिलाया जाता था। 4 दिन तक क्या बोलते थे सब लोग कि ये 9 महीने का छिका हुआ दूध है, इसको भगवान के लिए, देवता के लिए चढ़ा दो, देवता के लिए चढ़ाया जाता था। जब मैंने प्रशिक्षण के द्वारा जब गृह भ्रमण में जाके मैंने गृह भ्रमण में सभी माताओं और बहनों को मैंने बताया। जब गृह भ्रमण के दौरान गई तो एक उस घर में गई जहां बच्चा तुरंत हुआ था, उसमें मैंने तीनों का संगठन बना के मैं उस घर में गई और मैंने पूछा, क्यों माता जी अपने नाती को आपने दूध पिलाया? अरे कई बहन कैसे पिला दे, 9 महीना को छिके छिकाओ ऐसा गंदा दूध। हमने तो बाबा जी को चढ़ा दो, 4 दिन बाद हमारे ते पिलाओ जात। फिर हमने अपने प्रशिक्षण में सीखा, हमने उनकी दादी अम्मा को, जिठानी को, देवरानी को, सबको बिठाया और समझाया कि नहीं माँ ऐसा नहीं है। जैसे एक जानवर के बछड़ा बच्चा होता है, जानवर अपना तुरंत दूध पिलाता है, तो अपन मनुष्यों के क्यों नहीं अपने बच्चे को दूध पिला सकते हैं? जब मुझे इस बात से पता, और जब जानवर का दूध पिएंगे तो जानवर जैसी बुद्धि होगी, और जब एक माँ मनुष्य का बच्चा दूध पिएगा तो बिल्कुल उसमें ताकत आएगी, वो ताकतवर बनेगा। और हमारे यहाँ जब बुंदेलखंड में बच्चे इस वक्त लड़ाई लड़ते हैं तो माँ के दूध के लिए ऐलान करते हैं कि आजा बीच मैदान में, अगर तुझने माँ का दूध पिया हो तो बीच में आजा सामने। तो ऐसे इस प्रशिक्षण से मुझे इतने लाभ मिले कि मैं इतनी खुश हूँ कि मैं खुद नहीं समझ पा रही हूँ। फिर जब मैं एक दिन मीटिंग कर रही थी, उसी में से एक गर्भवती माँ निकल के आई और मुझसे बोलने लगी, बहन हमारे 2 बच्चे मर चुके हैं, जैसे बच्चा होता है और कम वजन का होके और हमारे बच्चे खत्म हो जाते हैं। फिर मैंने बोला कि आप बताइए आपके कितने महीने हैं? बोली दीदी मेरे 3 महीने हैं। मैंने कहा जब आपका पहले बच्चा हुआ था जो खत्म हो गए हैं, उसमें आपने क्या टीका लगवाए थे? कि नहीं नहीं दीदी हमने नहीं लगवाए थे टीके, हमारा तो हाथ दर्द करता है। नहीं, जब बच्चा हुआ था तब हमने 1 घंटे के अंदर दूध पिलाया कि हमारी सास ने नहीं पिलाने दिया था। तब उसकी पूरी देखरेख मैंने शुरू से लेके आखिरी तक पूरी देखरेख रखी। उसको टीटी के इंजेक्शन लगवाए, आशा बहन से मिलकर, एनएम दीदी से मिलकर मैंने उसके लिए आयरन की गोली दिलवाई, 100 गोलियां दिलवाई। उसको जानकारी नहीं थी कि कैसे खाना पड़ती है, इसके लिए बताया कि 1 गोली रात में सोते टाइम पर प्रतिदिन खाना है पानी के साथ में। उसका मैंने पूरा देखरेख किया। जब डिलीवरी हुई तो मैं उनके घर पे पहुंची और 1 घंटे के अंदर उनको स्तनपान कराया। जब भी गर्भवती कोई होती है तो 9 महीने तक हम उनके दिमाग में ऐसा भर देते हैं स्तनपान के बारे में कि वही बात नजर आती है कि 1 घंटे के अंदर मुझे स्तनपान कराना है। आज जब मैंने उनके बच्चों का इतना देखरेख किया, डिलीवरी करवाई, 6 महीने तक मैंने कुछ नहीं देने दिया और 6 महीने के बाद जब मैंने ऊपरी आहार शुरू करवाया, माँ का दूध भी 2 साल तक पिलवाया, आज उनके 2 बच्चे हैं, सुरक्षित हैं, अच्छे हैं। इसी 2 बच्चों के बाद में मैंने ऑपरेशन भी बच्चों का करा दिया, माँ का करा दिया है। आज वो माँ भी बहुत खुश है, हमारा समाज और गांव भी हमारा बहुत खुश है और मैं भी इतनी खुश हूँ कि मैं बता नहीं सकती हूँ। मुझे तो ऐसे लग रहा है जैसे स्तनपान की संस्था ने मुझे एक डॉक्टर बना के रख दिया है। ना मुझे कहीं बाहर जाना पड़ा, ना मुझे पैसे खर्च करना पड़ा। तो आज मैं सभी से विनम्र और इसी काम को करते हुए मेरे गांव में मुझे इतनी पूछ होने लगी, मेरे गांव वाले मुझे इतना सम्मान देने लगे। आंगनवाड़ी दीदी एक तो हमारे डॉक्टर हो गई हैं जो किसी पैसे से दवा नहीं खरीद सकते, कहीं जाके दवा नहीं खरीद सकते, जो बिगर पैसों में घर पे बैठे हुए सारा इलाज हमारी आंगनवाड़ी दीदी करती है। आज मुझे बहुत खुशी हो रही है। इसी काम को करते हुए मुझे आंगनवाड़ी में एक ट्रेनर के रूप में मेरे ब्लॉक पे मेरे डीपीओ सीडीपीओ ने मुझे ट्रेनर के रूप में बना दिया। मैं सारी आंगनवाड़ी बहनों को ट्रेनिंग देती हूँ। मैं सभी बहनों के लिए ट्रेनिंग देती हूँ, सभी बहनों को ट्रेनिंग देती हूँ। और आज मेरा आंगनवाड़ी केंद्र एक आदर्श मॉडल सेंटर के रूप में मेरा आंगनवाड़ी केंद्र बनाया गया है, जो जिला ललितपुर में टॉप है। और मैं अपना रिकॉर्ड मेंटेन और आंगनवाड़ी का सारा काम सही ढंग से चला रही हूँ। और मैं धन्यवाद कहती हूँ स्तनपान संस्था के लिए कि आज मुझे इस मंच पे आने का अवसर मिला, जब मैं एक डॉक्टर बन के मैंने दिखा दिया है। और मैं आशा करती हूँ कि समाज का कोई भी गांव और समाज का बच्चा आदर्श बने और अपना एक अच्छा बालक नागरिक बन के दिखाए। जय हिंद, जय भारत।
बिमला जी, बहुत बहुत धन्यवाद। You are actually the most credible voice and the most honest voice to get across the message to people. और किस तरह से थोड़े फिल्मी डायलॉग्स के साथ थोड़ी सरल भाषा में आप अपने विचारों को लेके जा रही हैं और जागृत कर रही हैं वहाँ पर गाँव में विमेन को स्प्रेड कर ये मैसेज। बहुत बहुत धन्यवाद। And now, ladies and gentlemen, after this very inspiring message and the session which we had just now, I would like to take this opportunity and call upon Mrs. Madhuri Dikshit, the UNICEF celebrity advocate, who has brought in a tremendous amount of credibility and energy in the communications on various child rights issues and now on breastfeeding as the right of every child.
Honorable ministers on the dais, respected dignitaries on the dais and the audience, and ladies and gentlemen, a very good evening to you. I'm delighted to be here today, and thanks once again to UNICEF and the Ministry of Health and Family Welfare for inviting me to this very important and very meaningful event, MAA. You know, it's very difficult for me today, right now, because the most passionate voice was just heard. And really, a big round of applause to all my Asha Behens and the Anganwadi workers who work so passionately to spread this message of breastfeeding. Yes, we are discussing breastfeeding here. In our culture, this is something that has been spoken about for centuries. Writers have written about it, movies have been made about it, and artists have painted it. There's never been a doubt about its importance. It has been associated with a mother's love and connect with her child, and also the right start it can give her child. But I feel there's always a need to reiterate the important and good things in life. And this is one great thing: simple, effective, and so natural. Hence, when UNICEF spoke with me about this campaign, MAA, Mother's Affection, as a mother, I was totally drawn to it. It made me smile thinking of my own time with my children. And I felt there is even if there's a little bit I can do to support the already amazing work of the Ministry of Health, Government of India, I will feel like I have made some contribution. I would like to share only two things about breastfeeding. Mother's milk in the first hour of birth, which is also known as colostrum, is critical, and every family member has to encourage the mother to ensure that the child gets it. The family, especially the husband, must support his wife who has delivered his baby. Second is that the breastfeeding for the first 6 months is another important thing, not even water, unless, of course, there have been some circumstances where the doctor has recommended the child to have some. Finally, I would like to end by mentioning a word: support. Support is very necessary. कहते हैं ना, जब माँ बनती है तो कहते हैं अरे ब्रेस्ट फीडिंग शुड बी द मोस्ट नेचुरल थिंग, वो तो हो जाएगा, कर लेगी। लेकिन ऐसा नहीं होता, क्योंकि उसमें भी इश्यूज आ सकते हैं, प्रॉब्लम्स आ सकते हैं। तो उस माँ के साथ बहुत क्लोजली अगर उनकी फैमिली उन्हें सपोर्ट करती है, अगर उनकी माँ, उनकी मदर इन लॉ, उनके हस्बैंड सब उनको सपोर्ट करते हैं, उन्हें वो काउंसलिंग दिलाते हैं जो उनको वो प्रॉब्लम सॉल्व करने में हेल्प करे, ताकि वो निराश फील ना करे। क्योंकि बहुत से लोग निराश होकर ब्रेस्ट फीडिंग बंद करते हैं क्योंकि उन्हें दिक्कतें आती है उसमें। तो अगर ये सपोर्ट उन्हें मिले तो आई थिंक वो सक्सेसफुली एक माँ का रोल कर सकती है। Let's support mothers to breastfeed. The government is doing what they have through lakhs of health workers. But we all, each one of us, has to play a role in contributing to this massive job. I urge the media to write about this campaign, which will encourage many more mothers and women to breastfeed. Thank you very much. Thank you.
Thank you so very much, ma'am, for your views. And when it comes from you, it definitely makes a lot of difference. Thank you for being the voice of this program. And now I would like to request and invite the Honorable Minister of State for Health and Family Welfare, Ms. Anupriya Patel, for her address.
Honorable Union Minister of Health and Family Welfare, Shri J.P. Nadda ji, Honorable Minister of State for Health and Family Welfare, Shri Fagan Singh Kulaste ji, dignitaries on the dais, UNICEF representative to India, Mr. Louis George Arsenault, UNICEF Celebrity Ambassador, Madhuri Dikshit ji, on the dais, our Secretary, C.K. Mishra ji, Madam Vandana ji, Madam Leena ji, DGHS, Dr. Prasad, Mr. Arun Panda, all the senior officials from the ministry, my friends from the media, ladies and gentlemen. It's indeed my privilege to be here with you all on the auspicious launch of this beautiful initiative by our ministry, MAA, the breastfeeding program, MAA, Mother's Absolute Affection. Honestly, there could have been no better name for this campaign. And while I consider it my privilege, coming for this program also gives me a mixed feeling. On one hand, I'm glad. I feel good that we have developed consciousness to promote this cause of spreading awareness about breastfeeding, which is so essential to a child's survival. But on the other hand, it also makes me think that where have we reached in this journey of civilization? We've forgotten the roots of our very existence, and for something as natural and simple as breastfeeding, we all have to sit here and discuss and talk that we want to promote this idea. But better late than never. Yes, the society has undergone a lot of transformation. Certain things have happened for the good, and certain things, of course, have not been so positive. So our responsibility as conscious people in the community is always to strengthen what will do best to the society. Friends, if you ask a newborn baby, if you ask an infant to draft his or her manifesto, what are the things he or she would demand? 3 things. He or she would say, I want my mother's warmth, I want my mother's milk, and I want the security that I get in her presence. And this 3-point agenda of food, security, and warmth is completely met in this breastfeeding. And this is extremely essential and critical to a child's survival. Why? Because as per the figures, as many as 13% of the deaths of small babies are happening in the absence of proper breastfeeding. And I'm glad the Ministry of Health and Family Welfare has taken up this initiative. UNICEF has come forward, and all the conscious and aware people are here to promote this cause. Ladies and gentlemen, as the speakers before me also mentioned, that in the initial days, the colostrum, which is produced in the initial days, that is like a natural vaccine, or the most natural nutrient which is good for the child. And so, breastfeeding must start as immediately as within 1 hour of the birth of the child. And it's not just protects the child against various forms of illnesses and diseases, but as my Asha and A&M sisters also mentioned, कि बच्चा बड़ा कुशाग्र होगा. And scientifically it has been proved that the IQ goes high by 3 to 4 points. You also protect the child from becoming overweight or obese. And breastfeeding not only brings benefits to babies, but also to the mothers. And one such biggest benefit is protecting mothers, protecting women against developing breast cancers. So the Ministry of Health and Family Welfare, it's really thinking seriously about creating an enabling environment wherein the mothers get all the necessary guidance, counseling, support, and encouragement to adopt breastfeeding when they deliver their children. And the 3 points that are being majorly focused upon, the first being initiation of breastfeeding within the first hour of birth. Secondly, exclusive breastfeeding for 6 months. And thirdly, continued breastfeeding after 6 months up to 2 years, along with the other nutritional supplements. And mothers, as our grassroots Asha and A&M sisters have told us, that although we might think that breastfeeding is something which may be absent or poor in urban women, but as our secretary also informed, that there is no difference in the rural areas as well. And women do need counseling for something as natural as breastfeeding. The Ashas and the A&Ms have given us examples, beautiful examples, real-life examples, wherein the mother-in-laws or the sister-in-laws or the other members of the family are not letting a woman who's delivered a child to breastfeed her own child. And they don't even understand the importance and relevance of mother's milk. So even those women need to be taught. And I take this opportunity of congratulating and saluting our sisters who are actually doing a great deal in creating this awareness and shaking up people and spreading awareness and informing the families about the benefits of breastfeeding. And this is exactly what the ministry desires to achieve. Ladies and gentlemen, we all have to go a long way, and each one of us must contribute his or her bit. And I'm sure if we all stand up to this cause, we can together give every baby the best start of his or her life. Our government, led by Honorable Prime Minister Shri Narendra Modi ji, and of course our ministry, headed by Honorable Union Minister for Health and Family Welfare Shri J.P. Nadda ji, stands committed to the cause. And as the slogan goes, स्तनपान विकल्प नहीं संकल्प है. So I appeal and urge to all of you, let's make it a resolution. आज हम ये संकल्प लें कि स्तनपान के संबंध में सारी जागरूकता फैलाने के लिए हम सब अपना अपना कुछ न कुछ योगदान अवश्य देंगे. इन्हीं शब्दों के साथ मैं अपनी बात को समाप्त करती हूँ. Thank you very much all. जय हिंद.
Thank you, ma'am, for your very affectionate and impactful message. At times we forget something which is as simple as breastfeeding, and it has to be that all of us has to come together to drive this message to every mother and to every family member. Thank you very much, ma'am. And may I now request Shri Fagan Singh Kulaste, the Honorable Union Minister of State for Health and Family Welfare, for his address.
राष्ट्रीय स्तनपान कार्यक्रम माँ एक संकल्प की से शुरुआत की से अवसर पर हमारे माननीय जगत प्रकाश जी नड्डा, माननीय स्वास्थ्य मंत्री परिवार कल्याण, मेरी योगी श्रीमती अनुप्रिया पटेल जी, सेक्रेटरी सी के मिश्रा जी, श्रीमती ईना नायर जी, लुइस जॉर्ज अर्चनर्ड, माधुरी दीक्षित जी, हमारे पंडा जी, जगदीश जी, वंदना जी, सभी वरिष्ठ अधिकारी, मीडिया के मित्रों, देवी और सज्जनों, वास्तव में आज एक विशेष कार्यक्रम, राष्ट्रीय स्तनपान कार्यक्रम माँ का एक संकल्प की शुरुआत हम आप सबके लिए आज इस राष्ट्रव्यापी स्तनपान कार्यक्रम माँ एक संकल्प कार्यक्रम के शुभारंभ के अवसर पर आप के साथ में शामिल होने, और मेरे लिए खास तौर से सौभाग्य की बात यह है कि इस कार्यक्रम में स्तनपान पद्धतियों में सुधार करने के लिए स्वास्थ्य और परिवार कल्याण विभाग भारत सरकार का एक महत्वपूर्ण एक कार्यक्रम है। जब मैं पूरे देश के परिदृश्य को देखता हूं तो वास्तव में स्तनपान बच्चे का पहला प्राकृतिक जीवन रक्षक तथा पोषण का एक सर्वोत्तम स्रोत है। जो भी यह बच्चा स्तनपान बच्चे के स्वास्थ्य जीवन के लिए सर्वप्रथम वो उसका एक आधार है। जब हम बच्चे के जन्म से लेकर और मां के बारे में जब हम विचार करते हैं तो अपने आप इस बात के लिए, और जब अनेक हिस्सों में हम इस बात को देखते हैं तो थोड़ा सा हमारे देश में जो स्थितियां हैं, मैं इसलिए इस बात को यहां उद्धृत करना चाहता हूं कि अर्बन और रूरल थोड़ा इसमें डिफरेंस। अभी हमारी बहनें यहां कह रही थी, जो आशा वर्कर्स के तौर पर अनुभव करने के बाद, अगर बच्चे को वास्तव में स्वस्थ रखना है, तंदुरुस्त रखना है, तो हमको इस प्रकार का माहौल बनाना पड़ेगा, एक वातावरण बनाना पड़ेगा, और इसके लिए हमको कोई ना कोई इस प्रकार का संसाधन और जागरूकता, अवेयरनेस, यह हमको अपने क्षेत्र के अंदर, देश के अंदर, चाहे किसी गली कूचे की हम बात कर लें, चाहे हम शहर के किसी वार्ड की बात कर लें, ये जब तक इस प्रकार का प्रयास हम नहीं करेंगे तो एक माहौल हम बना नहीं सकते। और इसलिए आज स्तनपान पोषण और शारीरिक विकास की दृष्टि से एक महत्वपूर्ण होता है, और बचपन में होने वाली बीमारियों से लड़ने के लिए एक शक्ति प्रदान करना, जैसे अभी बहन जी कह रही थी, अपनी ताकत से जब हम संघर्ष करते हैं, जब हम बच्चे को देखते हैं समाज के अंदर वो किस प्रकार का पलता है, बढ़ता है, उसमें आत्मविश्वास जागृत होता है, ये इसी से संभव है। और जब तक इस प्रकार का हम प्रयास नहीं करेंगे, मां का उसको लाड़ प्यार नहीं मिलेगा, तब तक देश की एक साहसी नौजवान की तरह वो आगे नहीं बढ़ सकता और उसमें आत्मविश्वास नहीं हो सकता, और ये तभी संभव है। और इसलिए इसकी आवश्यकता आज है। लगातार स्तनपान के से बच्चों के स्वास्थ्य में निरंतर सुधार होता है, और इसका असर पूरे जीवन काल पर हम दीर्घकालिक स्वास्थ्य पर पड़ता है, जिससे कार्य करने की क्षमता बढ़ती है तथा कुछ संक्रामक बीमारियों का जोखिम भी कम होता है। इससे स्वास्थ्य पर सीधा अगर इस प्रभाव को हम देखेंगे तो स्तनपान माताओं के लिए स्वास्थ्य और सलामती में भी योगदान करता है। यह बच्चों की बीच का अंतर रखने में मदद करता है। स्तन कैंसर के जोखिम को भी कम करता है। यह भी देखा गया है कि अभी जैसे सहरिया का उल्लेख हुआ, आदिवासी क्षेत्रों में नवजात मृत्यु दर अक्सर कम पाई जाती है। उसका कारण यही है कि अत्यधिक स्तनपान कराने जैसी पारंपरिक नवजात देखभाल पद्धतियों को अपनाना, ये अक्सर ग्रामीण क्षेत्रों में, ऐसे क्षेत्रों में देखा जाता है और विशेषकर जनजातीय क्षेत्रों में। और इसलिए जब इस प्रकार के अनुभव, सारे रिपोर्ट्स, जितने भी इस प्रकार के सर्वे होते हैं, तो उसके जो आंकड़े आते हैं उससे इस बात का पता चलता है। और इसलिए आज इसकी आवश्यकता भी है कि इसको बढ़ावा देना, प्रोत्साहित करना और इस प्रकार का माहौल को जन्म देना। जन्म के 6 महीने के बाद स्तनपान के साथ साथ उचित अतिरिक्त आहार शिशुओं और छोटे बच्चों की देखभाल के लिए एक महत्वपूर्ण पहलू है। उचित खान पान पद्धतियां बच्चों का देखभाल करने वाले के साथ साथ बच्चों का एक गहरा रिश्ता बनाती है। ये कौन हो सकते हैं? ये उनको मानसिक सामाजिक विकास को बढ़ावा देती है। ये इस प्रकार का इस समाज के अंदर, उस परिवार के अंदर एक वातावरण की आवश्यकता है और इसकी बहुत जरूरत है समाज में। तभी समाज में इन बच्चों को हम इस प्रकार का एक माहौल में पैदा करना, माहौल बनाना और उनको स्थापित करना। लगभग प्रत्येक माता सफलतापूर्वक स्तनपान करा सकती है। सभी माताएं, विशेषकर वे माताएं जिन्हें स्तनपान कराने में आत्मविश्वास की कमी है, को परिवार तथा स्वस्थ देखभाल करने वालों को प्रोत्साहित करना और व्यवहारिक सहयोग की आवश्यकता होती है ताकि वो सफलतापूर्वक स्तनपान करा सके। ये बात इसलिए कि हमारे यहाँ कुछ है, समाज में इस प्रकार की जो प्रवृत्ति है इसको समाप्त करना पड़ेगा। कई बार बाहर का दूध का उपयोग उस परिवार के अंदर मां भी करती है और इससे एक से हम अपने बच्चे के लिए या उस बच्चे के इस जीवन के लिए हम अपने आप में कहीं ना कहीं उसको अंधकार में या उसके सामाजिक जो जीवन है उसमें कहीं ना कहीं कमी आएगी, या हम अपने आप में इस बात को अनुभव करते हैं। और इसलिए शिशुओं और माताओं दोनों के लिए इस तरह की सहायता प्रदान करना लाभकारी होता है। स्तनपान नवजात शिशुओं की मृत्यु दर में भी कमी, बचपन में होने वाली बीमारियों से रक्षा और असंक्रामक रोगों की रोकथाम में महत्वपूर्ण योगदान देता है। साथ ही साथ इससे बच्चे के मस्तिष्क का विकास और माता के स्वास्थ्य की भी रक्षा होती है। और इससे जो ये बीमारियों के बारे में हमेशा जो चर्चा होती है समाज के अंदर, इससे कहीं ना कहीं अगर आत्मविश्वास के साथ में हम इस प्रकार का एक माहौल बनाएंगे, हम उस परिवार, उस बच्चे के साथ में भी इस प्रकार का एक व्यवहार करेंगे, तो मैं ये कह सकता हूं कि उस बच्चे को स्वस्थ रखने के लिए जो बीमारियों का, संक्रामक बीमारियों का जो प्रभाव देखा जाता है वो इसी ही कारण से अभी उदाहरण यहाँ पर बताया गया, और उसका प्रभाव समाज में कितना दुष्प्रभाव पड़ता है ये भी हमारे सामने निकल करके आया। हम आज तरह के सहयोग की आवश्यकता होती है जिसमें विशेषकर माता को स्तनपान कराने में मदद मिलती है। ये परिवार और सामाजिक सहयोग, कार्यस्थल और रोजगार, सरकार एवं कानून, स्वास्थ्य देखभाल और संकट अथवा आपात स्थिति में तुरंत सहायता, ये कुछ ऐसे कारण हैं जिसमें कहीं ना कहीं एक दूसरे से जुड़ाव के कारण हम इसको सहयोग कर सकते हैं। और इन सभी 5 तरह की सहयोग प्रक्रियाओं को एक साथ मिलकर हम काम कराना चाहिए ताकि इससे स्तनपान को और बढ़ावा मिल सके तथा माँ अपने बच्चे का पूर्ण ख्याल रख सके। आज हम सरकार द्वारा आरंभ किए गए इस कार्यक्रम को मजबूत बनाने, इसके लिए उचित वातावरण तथा मातृत्व सुविधा केंद्रों में स्तनपान को बढ़ावा देने के लिए निजी क्षेत्र में स्वास्थ्य देखभाल प्रदान करने वाली उन संस्थाओं को भी आमंत्रित करते हैं। स्तनपान के महत्व तथा स्तनपान का शिशुओं के विकास में अहम योगदान को देखते हुए भारत सरकार के स्वास्थ्य एवं परिवार कल्याण मंत्रालय ने मां का एक संकल्प कार्यक्रम शुरू किया है, जो अब पूरे वर्ष चलेगा, ताकि स्तनपान की दर में बढ़ावा हो सके। इस कार्यक्रम का उद्देश्य नर्सों, एएनएम, आशा कर्मियों की क्षमता को बढ़ावा देना, ताकि वे स्तनपान के लिए गर्भवती महिलाओं तथा माताओं और उनके परिवार को आवश्यक जानकारी और परामर्श सहायता प्रदान कर सके। यह हमारे लिए इसलिए भी आवश्यक है, आज समाज में जिस प्रकार की जो थोड़ी कमी है, आज इसको बढ़ावा देना, इस प्रकार के हमारे जो वर्कर्स है, चाहे मेल हो फीमेल हो, मां कार्यक्रम के प्रत्येक शिशु को अधिक से अधिक स्तनपान कराए जाना सुनिश्चित करने के लिए स्वास्थ्य और परिवार कल्याण मंत्रालय प्रतिबद्धता को दोहराता है। मुझे विश्वास है कि स्तनपान कराने की आवश्यकता पर नए सिरे से ध्यान देते हुए भारत में ऐसा बदलाव आएगा जो हम सभी देखना चाहते हैं। हम एक ऐसा राष्ट्र बनाना चाहते हैं जहां हमारे बच्चे सुरक्षित जीवन जिए तथा अपनी पूरी क्षमता से विकास करें। बच्चों का उचित विकास उज्जवल एवं स्वस्थ भारत की परिकल्पना को पूरा करेगा। आइए हम सभी मिलकर मां एक संकल्प कार्यक्रम को सफल बनाने का संकल्प लें, ताकि ज्यादा से ज्यादा बच्चों को उचित समय पर स्तनपान तथा ऊपरी आहार मिल सके। इस प्रकार की अपेक्षा करते हुए ये पूरी जिम्मेदारी के साथ हमारे श्रीमान नड्डा जी, हमारे देश के प्रधानमंत्री जी की भी अपेक्षा है कि हमारे इस देश में ये जो बच्चे है, शिशु है, आने वाले इस भविष्य के लिए पूरी ताकत से इस लड़ाई को हम लड़ें, ताकि इस समाज के अंदर इस प्रकार का माहौल बना सकें। ऐसी अपेक्षा के साथ आप सबको धन्यवाद, नमस्कार, जय हिंद।
माननीय मंत्री जी का बहुत बहुत धन्यवाद उनके संदेश के लिए कि ये पूरा कार्यक्रम लोगों को जागृत करने की तरफ है और एक सुरक्षित जीवन देने की तरफ, और साथ साथ क्षमता के अनुसार विकास हो सके हमारे बच्चों का, उसकी तरफ ये पूरा कार्यक्रम है। माननीय मंत्री जी का बहुत बहुत धन्यवाद टू ऑल्सो हाईलाइट द वेरियस इनिशिएटिव्स which his ministry is taking towards further promoting and driving this message to the society. And now, ladies and gentlemen, we have the most anticipated moment of this evening. That's the launch of the MAA program. And I would like to request the Honorable Minister to please launch the program by unveiling the technical and communication materials on MAA program through a short film.
वादा किया था मैंने। मैंने वादा किया था। वादा किया था मैंने वादा किया था। वादा किया था मैंने।
सुरक्षा जो मिले माँ के दूध और तन की गर्मी से पहले घंटे में, देर की तो बच्चे की जान को हो सकता है 1.5 गुना ज्यादा खतरा।
तुझसे वादा रहा पहले घंटे की सुरक्षा का।
गवाह कौन?
ये गवाह जी, पूरा किया ना मैंने वादा।
निकली सोन परी चांद दुलारे,
नहीं, पानी तो पिला दो।
6 महीने तो होने दे। दूध पिए रोज
दे दो।
रुक जा, पहले 6 महीने तो होने दे।
कुछ भी क्यों नहीं?
क्योंकि 6 महीने से पहले कुछ और खिलाया पिलाया तो हो जाएगा दस्त।
6 महीने तक सिर्फ मम्मी का ही दूध, समझी?
अरे वाह।
है अकेली, चल सहेली, जान के रहना है। देखो कितनी प्यारी, आय हाय, जाने क्या खाए, यूं बढ़ती जाए।
6 महीने में होगा माँ का दूध ही।
ना रे ना, जरूर खाए कुछ और भी।
कुछ और? वो भी 3-3 बार।
जान के ही जाएंगे इस बार।
दीदी, चावल का माड़
या फिर दाल का पानी? ध्यान से देख, है कुछ और कहानी।
आलू, कद्दू, हट बुद्धू,
भिंडी, टिंडा। तो 6 महीने में खिलाए क्या? अंडा।
मुन्नी ऐसी बढ़ती जाए। बताओ ना क्या क्या खाए? यही सब। बस 6 महीने की हुई अभी तो। अरे तभी तो।
घर में जो भी हो सब पकाओ, काढ़ा बनाओ और खिलाओ। 6 महीने जब पूरे हो जाएं, पेट पूजा की घड़ी आए।
बच्चे की सलामती, अच्छी सेहत और मस्तिष्क के पूर्ण विकास के लिए स्तनपान बहुत ही जरूरी है। आइए हम सब मिलकर अपने बच्चों को एक बेहतरीन शुरुआत दें, स्तनपान के लिए पूर्ण सहयोग दें।
So even the smallest member of the family needs to understand the very importance of mother's milk. And further, may I request the Honourable Minister and the other distinguished dignitaries on the dais to please release the coffee table book titled Status of Breastfeeding in India, along with the other technical communication and training materials on the MAA program. This is the coffee table book titled Status of Breastfeeding in India, along with the other technical communication and training materials on the MAA program, right now being released by the Honourable Ministers and the other distinguished dignitaries on the dais. Thank you to the Honourable Minister. Request to our friends from the media, please take your seats. Kindly be seated. And now would like to invite the progressive views and guidance and approach of the Honourable Minister, Shri J.P. Nadda ji. Inviting you, sir, for your address.
my esteemed colleague, Shri Bhagan Singh Kulaste ji, MOS, Ministry of Health and Family Welfare, Madam Anupriya Patel ji, MOS, Ministry of Health and Family Welfare, Louis Arsenault, the representative of UNICEF, Shri C.K. Mishra ji, the Secretary Health and Family Welfare, Madam Nair, Secretary WCD, the Celebrity Advocate for MAA program, Madam Madhuri Dikshit ji, Shri Jagdish Prasad ji, Shri Arun Panda ji, Madam Vandana ji, respected ladies and gentlemen, representatives of media, print media and electronic media, and dear friends. It is indeed a matter of great happiness and a great occasion when we are launching the MAA program, a beautifully worded program, Mother's Absolute Affection. And the launching has been done in the presence of the Celebrity Advocate, Madam Madhuri Dikshit ji. First of all, on behalf of UNICEF and Ministry of Health and Family Welfare, I thank Madam Madhuri Dikshit ji for accepting the invitation of becoming the Celebrity Advocate for MAA program. The ministry thanks, and we feel with your voice we'll be able to reach to the people in the most impressive manner, and the communication of this program will be best received by the mothers of the country in large number. I would also like to thank my officers who have, in a very short span of time of just 2.5 months, they have been able to launch this program. It was only some 2.5 months back when I had said that we should go for very cost-effective interventions. And we talk about big things, but small interventions are very meaningful. And this is one very cost-effective, significant health measure which we should take. And the officers have done a really great job. A lot of brainstorming sessions were done, and they have come out with this program. And they have also come out with details how this program is to reach at the grassroots level, how it is to reach the nook and corner of the country, and how the ASHA and the ANMs are going to take care about this program. So once again, I congratulate and thank my officers also for making this program. And I hope, I'm not only hope, but I'm confident that this is going to make a great, this will be of great help in reducing the under 5 mortality. Dear friends, we all know, and I would like to share with you, that the national health indicators are declining faster than the world pace of the world health indicators. If we talk about IMR, infant mortality rate, if I talk about MMR, maternal mortality ratio, if I talk about TFR, if I talk about under 5 mortality, the decline is much faster than the world pace. India is going forward in that direction. And the NHM has been really instrumental. We have taken an approach where our secretary has been always talking about life cycle approach. We have been talking about the continuum of care. When we take care of the mother right from the time she becomes pregnant, we take care of supplementing with iron and folic acid by giving them neonatal tetanus interventions. And as now India is free of neonatal tetanus, we have gone a long way. For the delivery also, a lot of interventions are being done. Institutional deliveries have been encouraged. And after the delivery, the immunization program has also taken with much intensity, and it has been intensified. We take an approach where we take care of the child right from mother becoming pregnant. We take care of the mother after the delivery. We take care of the child. We also see to it that all types of medical interventions are given till the child becomes adolescent. And this has helped in giving us this, in declining the IMR, MMR, TFR. Two interventions have been very cost effective, and it is a very significant health measure. One is this breastfeeding, when we say about mother's absolute affection program. And the another is deworming. That is also a very cost effective program where we make a child very healthy. Just by giving one pill in a year, we are able to see to it that the child is healthy and he is able to do his best. And a healthy child is certainly, it translates into a healthy India. So this program also, which we have been talking about, the breastfeeding, is also a very cost-effective program, and I hope all success, and I'm confident about it. But when I talk about breastfeeding, one thing amuses me, which is very strange also. Right when the humanity came into existence, which was natural, the market forces made it unnatural. जब से मानवता शुरू हुई, ये विडंबना देखिए कि आज हम कैंपेन कर रहे हैं फॉर ब्रेस्ट फीडिंग. वी हैव टू डू अ ब्रेस्ट फीडिंग कैंपेन. जब से मानवता शुरू हुई तब से, यानी अनादिकाल से यही नेचुरल था. लेकिन हमारी मार्केट फोर्सेस ने हमें कहां से कहां पहुंचा दिया. What to talk about urban area, what to talk about rural area, what to talk about educated mother, what to talk about uneducated mother. हर जगह अब ये कैंपेन करना पड़ रहा है for breastfeeding. And we have to tell about the advantages of breastfeeding. It increases your immunity level, it increases your intelligence level, it makes you more healthier. All these things are now to be told. तो हमको एक बात हमेशा समझ में आनी चाहिए कि the lesson is that we should not be driven by the market forces. और जो natural है उसी natural को आगे बढ़ाना चाहिए. I am very happy that ministry has decided, and this is going to take care of reducing the under-5 mortality. That is what I have to say. My previous speakers have talked about the first hour, that the close contact of the mother in the first hour of the delivery, how much meaningful it is. They have also shown the picture where they have talked about that not even water to be given for the first 6 months. It's only, and if the water is to be given to the child, it is only under the doctor's prescription. Otherwise, only the mother's milk should be given. And what supplementation should be given for the next 2 years. All that we are going to take care. But now I would like to see to it that my ministry also takes care how we can translate this program at the grassroots level. What are the issues which we have to address? I'm really, I was very happy to hear the experiences of community health workers, how aggressively they were advocating breastfeeding, and how much they were involved in the process. That attachment was seen in their speech. We have to see to it that we make them more trained, so that because their intervention is needed. And a special program is to be taken at the antenatal care program. When we go for antenatal care, we should make them understand that breastfeeding is a very important component after the delivery, which the mother should keep in mind. I think all those guidelines will be prepared accordingly. and the sensitization programs of Anganwadi workers, ASHA workers, A&M workers will be undertaken. And with all that monitoring and surveillance, we will be able to see to it that we have a healthy children and we have a healthy India. Once again, I thank Madhuri Dixit ji for becoming the celebrity advocate for this program, MAA program, and I congratulate and thank my officers for coming out with this program. I wish them all success, and Ministry of Health and Family Welfare will go forward in this direction. Thank you very much.
Thank you, sir, for your very inspiring words and very thought-provoking message. And also, we hope to continue to get your support and guidance for this program as we move forward. Thank you so very much, sir. And now I would like to request Ms. Vandana Gurnani, Joint Secretary, Ministry of Health and Family Welfare, to kindly propose a formal vote of thanks.
Good evening, everyone. Honorable Union Minister of Health and Family Welfare, Shri J.P. Nadda ji, Honorable Minister of State for Health and Family Welfare, Shri Fagan Singh Kulaste ji, Honorable Minister of State for Health and Family Welfare, Ms. Anupriya Patel ji, UNICEF Celebrity Advocate, Ms. Madhuri Dixit ji, respected Secretary, Health and Family Welfare, Secretary, Ministry of Women and Child Development, UNICEF Country Representative, DGHS, Additional Secretary and Mission Director, friends from the media, ladies and gentlemen. It's my privilege to propose a vote of thanks today at this landmark program for the launch of MAA, Mother's Absolute Affection, a nationwide breastfeeding promotion program. The last hour has been truly exhilarating as it embodies the spirit of the entire country, which has come together, so to speak, to ensure that every child gets his or her birthright, which is the mother's milk. At the outset, I would like to thank Honorable Union Minister for Health and Family Welfare, Shri J.P. Nadda ji, whose guidance and inspiring leadership has made this event possible. Thank you, sir, for encouraging us constantly to do better and better in our initiatives. I would also like to thank Honorable Minister for State, Shri Fagan Singh Kulaste ji, and Ms. Anupriya Patel ji for their gracious presence. I am sure that your address today will give a strong impetus to this program in the entire country. A very special thanks to Ms. Madhuri Dixit ji for agreeing to support this very important cause through her celebrity status. We are sure that your association with this cause is going to have a multiplier effect throughout the country in promoting breastfeeding. Thank you, Madam Leena Nair, Secretary, Ministry of Women and Child Development, for your constant support in all our collaborative work between the two ministries. The contours of this entire program were made under the able guidance of our Secretary, C.K. Mishra ji. Each element has been designed under his creative and inspiring guidance. Thank you so much, sir, for that. I would also like to thank Director General Health Services, Dr. Jagdish Prasad, and Additional Secretary and Mission Director, Dr. Arun Panda, for their gracious presence. We continue to look forward to your support and guidance. I'd also like to thank the senior ministry officers, additional secretaries, joint secretaries, and other officers from Government of India who are present here today to express their solidarity to this cause. मैं विशेषकर श्रीमती अंजना चौबे, आशा सुपरवाइजर, और विमला देवी, आंगनवाड़ी कार्यकर्ता के प्रति अपना आभार व्यक्त करना चाहूँगी, क्योंकि आपने ललितपुर से आकर अपना अनुभव जो हमें बताया है, इससे पूरे देश में सभी आशाओं और आंगनवाड़ी कार्यकर्ताओं को बहुत ही प्रेरणा मिलेगी। आज हमने करीब 11 लाख मैसेजेस सब आशा और एएनएम्स को भेजे हैं। ये कार्यक्रम लाइव दूरदर्शन पे देखने के लिए उन्हें सभी को आपसे बहुत ही प्रेरणा मिलेगी। I'd also like to thank the friends from the media for joining us today and for projecting and advocating this important issue of breastfeeding. The ministry has received immense support from our partners, UNICEF, especially in conceptualizing this entire initiative. Thank you, Mr. Louis Georges, for your support and for the support of your excellent team of professionals who have toiled alongside with us day and night in the past few months to make this possible. I would also like to thank our partners. You saw these amazing creatives. They have contributed immensely to this. Breastfeeding Promotion Network of India, BPNI, Bill and Melinda Gates Foundation, BBC Media Action, who have been supporting us constantly through this endeavor. And most importantly, tonight has been possible because of the untiring spirit of our Child Health Division in the ministry under the leadership of Dr. Ajay Khera. His entire team has been on a true mission to make this event possible. A special thanks to NIC, the IC Division, Doordarshan, the Design and Creative Management Agency for supporting this event. Thank you all, guests and partners, for joining us today. Have a nice evening. Thank you.
Thank you, ma'am. And with this, ladies and gentlemen, we close the formal part of this event. Many congratulations to all the people who have been involved. Once again, thanking the Honorable Minister for extending his leadership to this initiative. Ladies and gentlemen, the Honorable Minister has a very pressing engagement and he shall be leaving, but we shall continue with the latter part of this program, wherein we are going to be having media interaction. So all of you are requested to remain at your respective seats, and the questions from the media are going to be taken by respected Secretary, sir, and also we have our celebrity guest, Ms. Madhuri Dikshit, who is going to be part of this.